Hello and welcome. Today we'll be discussing a relatively rare but serious condition called Buerger's disease, also known as Thromboangiitis obliterans. This inflammatory disease primarily affects small and medium-sized arteries and veins, leading to blockages and potentially severe consequences, especially in the extremities. The exact cause of Buerger's disease remains somewhat of a mystery, but there's an incredibly strong association with tobacco use. In fact, it's considered almost exclusively a disease of smokers. All forms of tobacco, including cigarettes, cigars, chewing tobacco, and even smokeless tobacco products, are implicated. While the precise mechanisms are still being researched, it's believed that chemicals in tobacco trigger an immune response that attacks the blood vessels. Buerger's disease works by causing inflammation and swelling in the walls of small and medium-sized blood vessels, primarily in the hands and feet. This inflammation leads to the formation of thrombi, or blood clots, which obstruct blood flow. Over time, these blockages can cause severe ischemia, meaning a lack of oxygen-rich blood to the tissues. This chronic lack of oxygen can result in pain, tissue damage, and ultimately ulceration and even gangrene. Buerger's disease is relatively rare, but it's more common in certain geographic regions, particularly in the Middle East, Asia, and Eastern Europe. While it can affect people of any age, it typically presents in individuals between the ages of 20 and 45. Men are more frequently diagnosed than women, likely due to historically higher rates of tobacco use among men. However, with changing smoking patterns, the prevalence in women is increasing. The signs and symptoms of Buerger's disease can vary, but some common presentations include pain in the extremities, especially in the hands and feet, often described as burning or throbbing. This pain is often worse during activity and relieved by rest. Patients may also experience coldness, numbness, or tingling in the affected limbs. Skin changes such as pallor, paleness, or cyanosis, a bluish discoloration in the fingers or toes, are also common. In more advanced cases, painful ulcers or even gangrene may develop on the fingertips or toes. Diagnosing Buerger's disease can be challenging as there is no single definitive test. Diagnosis is primarily based on a combination of factors, including the patient's history, particularly their tobacco use, a thorough physical examination, and ruling out other conditions that can cause similar symptoms, such as atherosclerosis, autoimmune disorders, and blood clotting disorders. Tests like angiography, which uses dye to visualize blood vessels, may be used to look for the characteristic blockages and corkscrew appearance of affected arteries. A biopsy of an affected blood vessel may also be performed, although it's not always necessary. Buerger's disease is generally not classified into distinct types. However, the severity of the disease can vary widely among individuals, ranging from mild symptoms to severe ischemia and limb loss. The cornerstone of treatment for Buerger's disease is complete and permanent cessation of all tobacco use. This is absolutely critical to prevent disease progression. Unfortunately, many patients find this difficult, but without it, other treatments are unlikely to be effective. Other treatments focus on managing symptoms and improving blood flow. Pain management is crucial, and medications such as analgesics may be prescribed. In some cases, medication to dilate blood vessels, like calcium channel blockers or prostaglandins, may be used. Surgical options, such as sympathectomy, cutting the nerves that control blood vessel constriction, or bypass surgery to reroute blood flow around blocked arteries, may be considered in severe cases. Amputation may be necessary if gangrene develops, and there's no other way to prevent the spread of infection. The best way to prevent Buerger's disease is to avoid all forms of tobacco use. Never starting smoking or quitting smoking as early as possible is the most effective preventive measure. Avoiding exposure to secondhand smoke may also be beneficial. The prognosis for individuals with Buerger's disease depends largely on their ability to completely abstain from tobacco. If tobacco use continues, the disease will almost certainly progress, leading to worsening pain, ulceration, and potentially limb loss. With complete cessation, the disease may stabilize or even improve in some cases. Recent research is exploring potential new therapies, including gene therapy and cell-based therapies, to promote blood vessel growth and improve circulation in affected limbs. However, these treatments are still in the early stages of development. It's crucial for patients with Buerger's disease to work closely with their healthcare team to manage their condition and improve their long-term outlook.